The time is exactly 8 in the morning. Welcome to the program agenda. Today is November 11, 2021. It's a Thursday. Thank you for being subscribers of Cignal TV and watching Agenda on One News PH channels 8 and 250 here on Cignal. And thank you as well to those of you who watch us via facebook.com/one news ph. For those of you who are wondering, Cito, why do you always do that spiel? You never change that spiel. Well, essentially, it is a good way to start a day, to be grateful and to be thankful for those of you who watch the program, who subscribe to Cignal, and also for PLDT, who supplies us our home fiber internet, home fiber optic internet service. Alam niyo po, malaking bagay po yun. Okay, so be thankful and of course, you can watch us on YouTube for replays and also at 5 p.m. every day for the replay and on weekends. So we try our best to have new programs, new topics every day. But at the end, we can only do so much kasi 1 hour lang naman po. No? There was a time we were 2 hours, pero that was medyo unusual circumstances brought by COVID. In any case, let's now move to our daily starter. What sorrow for those who are wise in their own eyes and think themselves so clever. That's from the book of Isaiah, chapter 5, verse 21. And the prophet Isaiah here is warning people that if you think you are so smart, if you think you know it all, if you think that you are so wise, chances are sorrow is in your future. Why is that? Because the Lord does not like proud people, arrogant people, people who are filled with their own wisdom and is not reliant on the wisdom of God and does not respect the opinion of others. In this time of political maneuverings, that has become so evident that a lot of people think they're so wise, how they manipulate polls, how they manipulate surveys, how they manipulate the news, how they manipulate social media, all for the advantage of their group, their candidate, or for themselves. But there will come a time when you will live to regret or eat the fruits of your the fruits of your work or your harvest or your harvest kasi gano'n naman po no kung ano yung tinanim mo siyang kakainin mo and be careful whether it's in business at home, especially fathers who think they know it all and does not respect the opinion of others, especially their children. You may end up having children who treat you the same way you treated them when you become old, aged, or infirm. Hindi naman po sa nananakot ang Kuya Sito, but I have seen that. I have seen and heard the lament of some people who were not exactly the best parents or the best mentors, and you would hear them say, Grabe, they don't even respect me anymore. They don't even consider me anymore. Eh, you are simply reaping what you sow. So be careful. What sorrow for those who are wise in their own eyes and think themselves so clever. Yan po ang nag-aabang, naghihintay sa mayabang. And now let's go to the front page of the Philippine Star. Let's go to the headlines. DOH backs voluntary use of face shields after being the strongest opposition opponent for removal of the use of plastic face shields. The Department of Health has finally agreed, hallelujah, that the use of face shields can now be voluntary. Okay? But, laging may but. But it should be required for public utility vehicles. So, and also subject to the final approval of the Interagency Task Force for Emerging Diseases. Parang biglang sila ang naging Republic of the Philippines. Okay, so there you go. DOH backs voluntary use of face shields. And now let's go to the header of the Philippine Star. Bongbong not sliding down to Vice President for Sara. Thomson Lanchon, Secretary General of the Partido Federasyon ng Pilipinas, has stated that ex-senator, failed vice presidential candidate Bongbong Marcos will not slide down to the position of vice president in the event that Sara and BBM, agreed to run as a tandem. As far as Lanchon and BBM Group is concerned, Bongbong is the presidential candidate, not Sara Duterte. But ika nga, it's not over until the fat lady sings, as the opera goes, and we will find out, okay, who will be singing a different tune by November 15. That is 4 days away, my friends. Let's now go back. And there you have on the top a very big picture of the Philippine Star, where a principal of the Ricardo P. Cruz Elementary School in Taguig, Principal Cipriano Bisco, inspects one of the rooms that have been prepared for face-to-face classes, okay? Subject to the approval of the President and the final green light of the Department of Education also on November 15. Ano ba meron dyan sa November 15 na yan na parang pinagsabay-sabay ng tadhana lahat ng pangyayari? Okay. And beside that photo, we have the COVID-19 tally of cases. Okay? As of November 10, kahapon po yan, Bulaga. Here we go. Confirmed active cases, 34,866. And yesterday, the number of new cases 2006, 56. Wow! Parang count, ano? The count sa Sesame Street because it went up again. Yan na ang sinasabi sa inyo ng DOH ni Yusek Berhere and Secretary Duque. Please be careful because there is a possibility that the numbers can shoot up and we will find ourselves locked at home for Christmas. Okay? The number of deaths also went up. Yesterday, if I remember correctly, it was 94, di po ba? Biglang ngayon 154. Kanya lang I have to look into that 44,000 total. Kasi parang iba yung total ngayon kaysa sa kahapon. We'll look into that. Okay, but anyway, that's the situation. Number of new cases up, number of deaths up. Okay, talo pa ang stocks no? Anyway, Philippines seeks 500 million loan for booster shots, $500 million loan. Ha? Times 48 o 49 nyo na yan. Okay. Based on the project document released by AIB, a total of 553,066,000 is needed to finance the second health system enhancement to address and limit COVID-19 under the Asia Pacific Vaccine Facility Project or HIL-2. Parang ano no, yung binigyan. Anyway, of the total project cost, 250 million or approximately 12.5 billion each will be funded by ADB, okay, Asian Development Bank, and while AIIB or the Asian Infrastructure Investment Bank will cover the remaining 53.66 million dollars or 2.68 billion pesos. Okay. And then will be shouldered pala by the government. Sorry. My wrong. Okay, let's move on to back to the front page. And there's a nice picture that all of you are waiting to be part of. That is the cinema personnel of the Power Plant Mall in Makati showing the media what the seating arrangement will look like once they open their doors to movie goers. Eh ako talaga, ewan ko ba, ano ba yung, hindi ko na matandaan kung alin yung huling James Bond na hindi ko pa napapanood. Okay, I think it's time to die. But anyway, that's the seating arrangement. So if you are going to the movies thinking you're going to cozy up to your loved one, no way, Jose. It's still social distancing in the movie houses. And moving up, 8 business groups are seeking or asking the government to investigate the Malampaya deal. Do not ask the executive department. They're part of the deal. The DOE entered into that deal. So, okay. So, in any case, what you call this? The 8 business groups are challenging the financial and technical capabilities of the group that got into the Malampaya deal, particularly the group of Mr. Dennis Uy, and they want it investigated. Okay, moving forward. Moving forward, let's go. Nag-hold yata, nag-freeze. Okay, moving forward, you have that story. President Rodrigo Duterte, Rodi, vaxxed people are heroes while unvaxxed are pangit. Okay, sabi ni President Duterte in his recent address to the nation or his public address na those vaccinated are heroes while those who are unvaccinated are pangit. And well, I don't know if people will just simply ignore him or whether he is going to be targeted yet again. Okay. In any case, it was also announced that the national government will or is planning to launch a 3-day national vaccination program or national vaccination drive, I mean, on November 29, November 30, and December 1. Okay, so yun po, no? Abangan yan dun sa mga hindi pa nagpapabakuna, may pagkakataon pa kayo. Okay. And back to the front page of the Philippine Star. We have a photo of Philippine Marines personnel manning a checkpoint in Barangay Rebuken in Sultan Kudarat, Maguindanao yesterday, reminding motorists to have themselves inoculated against COVID-19 because the Bangsa Moro Autonomous Region in Muslim Mindanao has one of the lowest vaccination rates in the country. Okay, Parang awa na po, an appeal to our brothers and sisters in the autonomous region, Bangsa Moro Autonomous Region, please promote and subject yourselves to vaccination because while I was watching the global news last night on international channels, it seems that the countries or areas with the lowest vaccination have the highest number of COVID patients and ICU occupation. Okay, moving on. 10,500 health workers to be sent abroad next year. Okay, that is according to the Department of Labor and Employment, which intends to further increase deployment by 4,000, according to Dole. Okay, Labor Assistant Secretary Dominic Tutay said the government intends to increase by 4,000 the current 6,500 quota for foreign-bound healthcare workers. So, ayan po, maghanda na kayo. Get ready. Sharpen your skills. Get your passports, your documents, applications, etc. And down at the bottom of the front page of the Philippine Star, the Philippine National Police has a new PNP chief, okay, in the name of Leonardo Carlos. He is the former spokesperson of the PNP and is a member of the PMA Class 88. And he bypassed three senior officers when he got this appointment. So kumbaga, ganun siya kagaling or ganun kabilib si Presidente Duterte sa kanya. But in any case, his appointment apparently took a lot of people by surprise. Not only that Carlos was appointed, but because people were expecting it to be later this week, mga bukas or Monday. But nagkabiglaan. In fact, our guest for today was supposed to be one of our guests for today was supposed to be PNP Chief Eleazar, but we are now down to one guest. Okay, last but not the least, on the front page, we have that photo of Synergy Grid and Development, Philippines Inc. President CEO Paul Sagayo, as well as the President CEO of the Philippine Stock Exchange, Ramon Monzon, leading the bell-ringing ceremony of the PSE to mark SGP's listing of 1.05 billion follow-on offer shares yesterday. Kumbaga, ayan, kung gusto nyo mag-invest, ayan, binebenta na naman daw sa stock, binebenta sa stock market, panibagong batch ng shares. Okay, and that I believe is the final tally of the news on the front page of the Philippine Star. Good morning to our viewers, Mr. Alan Blackmon, who texted me. Apparently, there is some issue regarding what you call it, regarding the national ID. Bakit daw may nagtatanong ng blood, ano yun, blood test. Wala pong ganun, ano? There's no such thing as far as our interview yesterday was concerned. Okay, now for today, medyo please listen carefully because apparently, if you remember our interview yesterday with the PSA, the Philippine Statistics Authority and the PhilSys, the National ID Program, our guest Assistant Secretary Bautista mentioned that there are fraudulent activities on social media, Facebook, etc., where certain people are offering slots to fast track your application for the national ID. And she said that's bogus. That may be data mining, traps, etc., where they're going to steal your information. Well, today, our guest is the incident commander of the Philippine Heart Center COVID-19 response. He is also Executive Director for Medical Services of the Philippine Heart Center. And medyo because the Philippine Heart Center has apparently been subjected to political fake news and also by other unscrupulous or bad people who are trying to disrupt disrupt operations and services. Let's bring in Dr. Gerry Manzo of the Philippine Deputy Executive Director for Medical Services. Doc Gerry, good morning, sir.
Hi, good morning, Mr. Beltran.
Okay, mukhang puyat ka, Doc Cherry. Binibwisit ba kayo nitong mga hackers sa social media, etc.? I was told of a post na pati sa politika, nagamit na yung image ng Philippine Heart Center, Doc.
Yeah, actually, ang nagpuyat sa akin, ikaw eh. Kasi
Ha?
tinawagan
So,
niyo kami last minute eh. Anyway,
pasensya ka na, Doc. Alam mo naman, malakas kayo sa akin. Ako customer, lagi nyo, regular customer niyo ako. Sabi nga lagi ni Dr. Ho, welcome home.
yeah. So
Anyway,
anyway, that controversial Facebook post with very obvious political inclinations is
mm,
not an official and is also not an authorized social media account of the Philippine Heart Center. So when this social media post was first brought to our attention 2 weeks ago, the first thing we did was to find out first kung ano ba, galing ba talaga to sa heart center. And we confirmed that the two areas where we have Facebook posting sa outpatient namin kasi we had to uh, bring in Facebook to get to reach our outpatients, especially during the pandemic. And in our HR that is used to get the community together, both of them denied that they own and they were the ones posting. So this is not an official account. This is not sanctioned. We have actually issued a joint communication with the Department of Health denying that this is an official post of the Heart Center. We respect the rights of individuals to express themselves, but
mhm.
they do not have the right to misrepresent an organization, a national agency with the reputation of the Philippine Heart Center. So we have taken steps to request Facebook to take down this account, not only just the post, but to take down the entire account. And whoever the individual, and we have an idea who the individual is, but whoever that individual is, he can continue posting on his personal site, but cannot use the Philippine Heart Center. We are
Oh,
prepared to
mhm.
take measures to make sure this does not happen again.
Yeah, what sort of measure? What actually happened? What did they post? If you can mildly refer to the post, kasi syempre na-intrigue yung mga viewers natin and asking ano ba nangyari, and then also what sort of measures are you planning to take?
So yung measure muna is we have to make sure that the Heart Center is not misrepresented by a Facebook account that is not official. Uh, yung post is one of the interviews of one of the presidential candidates uh,
Mhm.
that will seemingly appear that the Heart Center is endorsing. So we are apolitical. We take care of all patients, regardless of affiliations, regardless. So we don't want to be part of politics. So we do not like what has happened to us. We are being forced to defend ourselves when we are very busy taking care of patients.
Mhm. Kumbaga, just so that ako na magsasabi, Doc, if you don't mind, may nag-post nung Bongbong Marcos interview yata with Tony Gonzaga, and my analysis is someone is trying to ride on on the history of the Heart Center, the founding of the Heart Center during martial law. So parang palalabasin na because of the history, baka ini-endorse, which is false. And true to your word, the Heart Center has been apolitical for so many decades. Now, what are you planning to do as far as this individual is concerned? Because I've been hearing a number of people who have filed cases, even the NBI, filing cases against individuals who misrepresent persons or institutions, as well as asking Facebook to block those individuals from being on social media.
we we are we are already in the process with Facebook, asking them to take it down completely. Uh, I am not personally the one in charge of it, pero I'm monitoring it. On the management side, we are prepared to take specific actions if we find out and we are able to prove that staff of the Heart Center, and we presume this is not an active plantilla staff, is the culprit, and we are going to take actions. Uh,
Okay. Uh-huh.
as, uh, as an aside,
Yes,
uh,
please.
there is one when they talk about Heart Center and attributing it to a person or to an administration, uh, we cannot actually deny that there was a vision that was then, and it is something that carries us on forward even up to now.
Mm,
On the wall outside the entrance of the Philippine Heart Center, and I don't know if when you visit us you see it. It's a small plaque, pero ang ganda-ganda niya eh. Kasi for people who are talking about the long-term strategy, we talk about big, hairy, audacious. Yung talagang mahirap, dream big. Ang
mm,
mission na nakalagay doon sa plaque na yun, ano eh, be there but one Filipino sick and uncared for. Our mission is not done. Talagang isinapuso namin sa Heart Center yan. So yung
mm,
pagpapasalamat namin doon sa vision at sa pagpagawa nito, wala namang katapusan yun. Lagi kami nagpapasalamat in very many occasions. Pero ang totohanan, di ba, ang
mm,
paggawa naman ng Heart Center, taxes na binayad ng tatay mo at tatay ko at ng mga
mm.
ninuno natin. So galing sa
Yes.
Pilipino to, regalo ng Filipino people to the Filipino people up to now. And we have
Mm.
been very, very faithful stewards of our mandate to take care of Filipino heart patients, especially the marginalized and the poor. Huwag na kaming ipolitika kasi gagawin namin talaga ang lahat para tumulong sa kapwa Pilipino.
Well, I will attest to that because, I mean, thanks to the Heart Center, I'm still alive. Kasi nakalimang tubo na ako dyan sa inyong cardiac unit. Na emergency room pa ako. And when I was in your emergency room, I saw there was no economic status, there was no social status. Pare-pareho kaming nakapila, pare-pareho kaming maghihintay at pare-pareho kaming binabantayan ng mga doktor. So I will salute the Heart Center, and I've always honored the Heart Center, and I appreciate your presence today as well as the leadership of the Heart Center. Now, in any case, since I already have you here, inistorbo na kita, Doc. Lulubos-lubusin ko na. How is the Heart Center now? I mean, I'm glad I'm not visiting the facility because that means I'm taking care of my health. But at the moment, how has the Heart Center managed because of COVID-19?
Uh, Siguro alam naman ng iba at lalo na yung mga nakakaalam tungkol sa COVID responses. Alam nila the Philippine Heart Center was one of the first, if not the first, to be assaulted by COVID.
Mhm.
Nauna kaming napuntahan ng mga pasyenteng merong mga matitinding sakit. And we have the dubious reputation na we lost the first two doctors in the entire Philippines, both of whom were cardiologists in the COVID
And
response.
who were considered the best in the country. I know a lot of people were really lamenting that loss.
Yeah, so even then, even during the peak of pandemic, we never stopped being the Philippine Heart Center. So we
Mhm.
were taking care of heart patients kasi alam namin as a hospital, there are many hospitals who can take care of COVID patients. But there are not very many hospitals who will be able to take care of, again, the poor and the marginalized heart patients. Kami lang yun eh. So we
Mhm.
never stop being the heart center. We kept on saying we are the heart center, but we are also designated as a national referral center for COVID. Mostly, so hindi kami tumatanggap ng pasyente, hindi kami nag-admit ng mild asymptomatic except for healthcare workers na binabantayan namin. Ang tinatanggap namin, puros mga severe and critical. But
Mhm.
right now, we are very focused on recovery, Mr. Beltran. And we seem to be on the right track as far as our resiliency initiatives are concerned. As we speak, uh, 90% of our patients are now non-COVID. We have not stopped admitting COVID severe patients, but they just comprise something like around 11, 12%. We do not have, no, as of yesterday, we did not have a single health worker that was confined except nung gabi, may pumasok na isang healthcare worker na positive. So sa amin dito ngayon, pag may healthcare worker, heart center staff na
Mhm.
positive, ina-admit namin sila. Kung wala silang quarantine facility at home, meron kami dito para sa kanila. We take care of all of them.
Okay, so what has been the consequence to the staff and the doctors of the heart center? Because kayo nga yung unang tinamaan, kayo yung unang dinatnan, unang tinamaan, unang namatayan. But when after everything had settled down, yung bang mga mga nurses, doctors, technicians, what is the situation now?
Medyo sanay na kami. Kung
Mhm.
minsan nga delikado yung masyadong kampante na. So there are times na nakikita namin, oh sige, binabantayan namin to araw-araw, nagbi-briefing kami. So we know na paunti ng paunti yung mga pumapasok na pasyente and thankfully kahit na nagkakasakit sila, hindi sila nagkakasakit dahil nahawa sila sa mga pasyente ng heart center o sa kapwa healthcare work. Usually nagkakasakit sila, ang transmission is community acquired. Galing sa labas pa nagko-commute,
Mhm.
dumating yung punto na gumagawa kami ng shuttle para hindi sila mag-commute. Kaya lang mahirap pag ang shuttle alas 4 ng umaga lalakad, ang duty mo alas 7. So
Mhm.
nagko-commute pa rin sila. So we just keep on reminding everyone, and actually that is the reminder for not only for heart center healthcare, para sa ating lahat eh. Ngayong nagbabalik normal na tayo, we need to take
Mhm.
care of ourselves. It is our responsibility to ourselves and to our families na bantayan natin ang sarili natin.
So aside from yung pag-alaga sa mga pasyente, etc., you've had to put up your own quarantine facility for staff and also a shuttle service. What about the scheduling or the shifting? Because I remember because of COVID-19, I've heard of stories where doctors and the nurses were working 12-hour shifts. Medyo, that is very hard on the healthcare workers, but also very disconcerting for patients. Kasi kung ako yung matatapat sa 12-hour ng thoracic surgeon, medyo nenervyusin ako. Kaya mo pa ba, Doc? Baka nanginginig na yung kamay mo.
Hindi naman tuloy-tuloy ano, pero actually hindi 12 hours ang shift ng mga doktor. Alam naman natin
Okay.
sa hospital, 24 hours, more than 24 hours yan. Papasok ka ng umaga, aalis ka hapon ng following day. Kung
Wow.
makakaalis ka pa. Pero ganun talaga yun eh. That's everywhere.
But by virtue of safety protocols or because sa dami ng pasyente na kailangan mong ikutan?
Neither siguro. Kasi kakaunti lang naman ang ano eh. Hindi naman ganun karami ang doktor. So
Hmm.
hindi pwedeng maluluwang na malaki ang interval between duties. So talagang tulong-tulungan lang. We all
How
went through this even when we were young doctors.
Yeah, how were you affected, the heart center, by all of by the trauma? Tawag nga nila hindi ba, post-traumatic stress disorder sa because of COVID. Marami raw nag-leave, nag-resign o nag-abroad. How did that phenomenon affect the heart center?
Nagpapasalamat ako sa mga kapwa heart center staff namin. They've been very loyal. When we needed them, they were here. Mararamdaman mo na nagrereklamo sila at napapagod sila, naaawa sila sa pamilya nila na wala sila, but they were always here for us. Hindi kami iniwan ng staff namin. Actually,
Mhm.
marami pa ang staff na naglumilipat galing sa ibang ospital papunta sa amin.
Why is that? Anong attraction sa heart center na gusto kayong puntahan? Dahil mas konti ang COVID or dahil pag nagtrabaho sa heart center, nagle-level up ang isang tao?
Uh, Gusto kong isipin na naka-level up talaga kasi we're very focused on the welfare, the professional career of our staff, but we're also as an organization very focused on doing the best for the Filipino patient. So ang sa amin talaga we're the first government hospital that is internationally accredited. We have
Mhm.
gotten national and so yung mga islands of good governance kasama kami doon. We have helped Department of Health hospitals get into their Good Governance Act. So medyo talagang focus kami na gumawa ng paraan na maibigay lahat ng pwede para sa Filipino patients natin. Hindi pwedeng nagpapagaling ka para sa mga banyaga. Ginagawa namin to para sa Filipino. The Filipino patients deserve the best.
Yeah, but you are also a teaching and training facility, if I'm not mistaken. In fact, in the last interview I did, I think of one of the senior management executives of Heart Center, we talked about extension trainings or something in the Visayas or regional areas. What's going on with the training and educational aspect of Heart Center?
We are kasi we're trying to, we have a very again the big hairy audacious goal. Yung ambition namin magkaroon ng heart center sa lahat ng regions. So
Mhm.
one of our stated strategic initiatives is to come up with at least one regional heart center in all the 17 regions of the country. So
Bravo.
we're now at by the end of 2021 we will be in region number 13, and we will only have 4 regions left that we need to cover. We are actually going to Marawi. We've been everywhere. We just came from Eastern Visayas in Tacloban. So we're doing open heart surgery in these places where it has not been done before, and we are making sure that they are not dependent on the Philippine Heart Center in East Avenue. Our intention is for them to become established independent heart center. So tinetrain namin yung mga taong galing sa mga probinsya. Dati kasi magdadalubhasa ka pero pagbalik mo sa probinsya mo, wala ka namang papapraktisan ng pinag-aralan mo. So now, when they go back to the regions, to the provinces, they will have a heart center to look at.
Okay. If you don't mind, Dr. Gerry, we'll just go for a quick break, and after the break, I'd like to give you and the Heart Center more opportunity to talk about the work you've done and the vision of the Heart Center. We'll be right back. We'll please keep it here on agenda. We'll be right back in a minute. Welcome back to the program agenda. I'm your host, Cito Beltran, and you are watching us via Signal TV, channels 8 and 250. And joining us today, this morning, is Dr. Gerry Manzo, Deputy Executive Director for Medical Services of the Philippine Heart Center. Doc Manzo, good morning again, and thank you for being with us. Doc, lilinawin ko lang, pasensya na po kayong nabulabog kayo kagabi. Kasi kagabi ko lang nakita yung post na yun yung tungkol doon sa heart center. So sabi ko, pakitawagan nyo nga yung heart center. Anyway, we've clarified that. I was just going through your career history, Doc Manzo, and you graduated College of Medicine de La Salle in 1984. You worked at the Philippine General Hospital in 1985. You went to De La Salle University Medical Center in 1990. Then you joined the Philippine Heart Center 1993. You were, I think, did you even work at Stanford University Medical Center in 2000?
Yeah, for heart transplantation.
Okay, now my question is, you could have stayed in Stanford. Stanford is one of the premier medical facilities in the United States, if not in the world. They also have a premier cancer facility. What was the deciding factor for you para bumalik ka sa Pilipinas at magtrabaho sa Philippine Heart Center?
It's not exactly right na ano na you have that option kasi pag dun ka magpa-practice, you have to repeat what you went through in cardiac surgery. You need to do general surgery over again. But more than that, ano ko eh, I've always been nationalistic. I've always been patriotic. I've always said love the Philippines even if it's very hard to love. Uh, ano
How
ako,
true.
Pinoy, Filipino ako. So I'm patriotic, I think.
Well, I respect that. And also, thank you for the education. Hindi ko alam na pag nagpunta ka sa Amerika, retake lahat yung mga specialization.
Yes, ulit yan.
So, another 4 years yun, Dok?
No, it's 5 years of general surgery and 3 years of cardiac surgery.
Aray ko
So
po,
another
di
eight
sana,
years.
di parang sana doon ka na lang nag-aral, ano?
Exactly. So kung talagang gusto mo dun sa ibang gusto mo sa kanila, you have to start all over again.
Okay, but why did you go to Stanford in the first place? Was it for further practice or for further training? What's the
Mainly,
benefit of?
uh, last frontier kasi natin yung heart transplant at that time. So
Mhm.
it is still a frontier for Philippine cardiology. We're actually embarking on reviving the heart transplantation program here in the Philippines. So pumupunta abroad yung mga may kaya, pero actually hindi naman sila mata-transplantin basta-basta kasi talagang napaka-premium ng organs, ng heart organs. So we're trying to
Mm.
see if we can do it again here in the Philippines.
Okay, now going back to the heart center, how are things in the PHC? Because I'm curious to know, nag-i-improve na ba yung how do you call it? Yung, because when I used to visit heart center as a patient, I'm part of that generation ng mga irresponsible, meaning matakaw, pabaya, maraming bisyo, and we pay for our sins later. But has the public or the Filipino become more educated, more health conscious, and have you had a reduction in cardiac-related cases in the heart center?
Uh, Hindi actually kasi end referral center kami, di ba? So
Mm.
pag although we have a very focused uh, research agenda namin on the advocacy to prevent cardiac diseases. To reduce the burden of heart disease, yung burden na nasa amin kasi are the advanced cases. So hindi kami nauubusan ng advanced cases. And as a matter of fact, that's the reason why we are doing the Regional Heart Center program. Para nga
Mm.
yung mga pasyente at saka meron silang mga advanced pero pwedeng gawin sa probinsya, ito na lang. The cost, the expense of doing it here in the heart center is not just the expense of uh, of intervention. Yung parang ginawa sa'yo, yung mga stenting at saka ano, it's not the cause of the surgery lang, 'di ba? Dadalhin mo yung bantay mo dito, usually hindi naman iisa lang, kakain kayo, you will have to stay in the in. So nagagawa na natin ngayon, and you'll be surprised that there are regional heart centers that have evolved so that they have their own cath lab machines, they have their own open heart capabilities. Magagawa natin to in a very short period of time. We think that many of these heart centers, which we started helping out since maybe 2012. So matagal ng maraming pasyente, pero ngayon lang nagkakaroon ng maraming heart center.
Yeah, but I confirm that. No, I saw the cath lab here in Mary Mediatrics in Lipa. It's a private hospital. I've seen the cath lab in Rizal Medical Center na natayo doon. And everywhere I go, there's always the mention na, oh, well, the experts in the Philippine Heart Center also consult or work with us, etc. But my pet peeve, honestly, and I'm not trying to be patronizing here. Alam naman ng mga ibang kaibigan mong doktor that I have been fighting for a bigger location for the Philippine Heart Center. Kasi ang sabi ko, hindi naman pwedeng pataas ng pataas, especially in an area na pasikip ng pasikip ang access because of traffic. What are the future plans for the Philippine Heart Center? Meron na bang nag-champion na senador or government officials para bigyan nyo ng mga ilang hektare yung heart center para maluwag?
Uh, Sito, one of the things kasi that in terms of perspective nga, di ba? Sabi mo,
Mhm.
give the heart center a bigger place. And we have a bigger place. It's the entire Philippines. You will not, you will be surprised when you look at the the regional medical centers. Ang gaganda na nila, maraming naigawa yung mga bagong administrasyon natin in the Department of Health to
Mhm.
support infrastructure in the regions. At yung mga nakakapagpatayo ng mga heart centers,
Mhm.
as a matter of fact, until our latest, we have 6 cath labs right now. Our latest cath lab arrived about 2 weeks ago. But before that time, there were two heart units that have cath labs that were more advanced than the heart center. You cannot believe the one in Tacloban and the one in Baguio mas advanced pa kaysa sa amin. Ngayon, syempre, dumating na yung sa amin na parehong modelo sa kanila. Pero ang point ko lang, you're talking about expanding the area of the heart center. What we are looking
Mhm.
at, expanding it by creating new heart centers so that the patients do not need to come to East Avenue to Quezon City. Nandun na sila. Ang pupunta na lang dito ngayon, puros mga advanced care.
Kumbaga, do not make yourself more powerful as the leader. Create disciples who will think and act like you, and you will spread the good around. So that's a very good philosophy, and I get it. Pasensya ka na, Doc Gerry, kasi kung mag-isip ako, parang infrastructure, headquarters, lawakan, at saka siguro, siguro na hihirapan na rin kasi akong pumarada sa dami ng customers yung pumupunta dyan. Nag-grab na lang ako. But,
Mukhang,
yes, sir.
mukhang matagal ka nang hindi rin nagpupunta, no? Mabuti naman, ibig sabihin hindi ka kumakain ng mga ng unhealthy foods na, no? Pero kasi meron kaming parking building na pupuno rin siya. But we built up sa likod namin sa Matalino, makikita mo siya. Merong ano,
Yeah, I use
merong
that
malaking
parking building.
oh, sa parking building.
Oh, I use that parking building, pero sabi ko nga hindi, sorry, I have to confess, I'm biased. I love the Heart Center, and I really believe in the services that the Heart Center does. But in terms of patients, sino na ba ang pinaka number one ng mga pasaway na mga nagiging pasyente ng Heart Center ngayon?
Unfortunately, acquired heart diseases pa rin. So kung pag pinag-usapan natin sakit sa puso, ang pinakamarami pa ring napipilitang operahan o dalhin sa cath lab, yung may mga sakit sa puso. And these are acquired heart diseases. Pwedeng iwasan kung mag-iingat ka sa katawan mo. Pero marami pa ring mga congenital heart diseases na hindi mo mapipili ang tatay at nanay mo. Hindi mo naman alam kung sino yung maglalabas sa'yo, di ba? So, hindi napipigilan yun eh. There is nothing
Mhm.
we can really do to prevent the congenital heart diseases kung hindi alagaan sila at saka gamutin sila habang pwede pa. Fortunately, nagagawa na namin yung mga mahihirap na dating pag inoperahan mo siguradong kukuhanin na ng angels in heaven. Ngayon, ang ganda ng ating mga outcomes. Ang isa pang sakit na gusto naming mapugsa yung tinatawag na rheumatic heart disease, yung mga sakit sa mga valvula. Sakit ng mahirap yun eh. Yun yung mga hindi makainom ng antibiotics pag nagso-sore throat ng bata sila. Pero ngayon, umuunti-unti na rin sila. Pero yung nakikita natin 20, 30 years ago, sila pa lang yung pumapasok ngayon eh. So we will see the effect of what we have been doing in trying to prevent rheumatic heart diseases 20, 30 years from now pa. Hindi biglaan.
Okay, Doc Jerry, we'll just do a quick break, and when we come back, paki-explain nga kung bakit nagiging sakit ng mahirap yung rheumatic heart disease. We'll take a quick break. We'll be right back here on Agenda. Okay, the time is 8:52. Welcome back to the program Agenda. I'm your host, Cito Beltran, with our guest, Dr. Gerry Manzo, Deputy Executive Director for Medical Services of the Philippine Heart Center. Doc Jerry, na-intrigue lang ako sa statement mo that rheumatic heart disease is mga sakit ng mga barbula at sakit ng mga mahirap. Kasi, ewan ko, if I fall under that, nagka-prolapse mitral valve ako. I'm a preemie, I'm a premature baby. Are these connected? Ano ba ito? Kasi, siyempre, malnourished din ako nung bata eh.
Hindi halata siguro, no?
Not anymore.
Nabawi mo nung lumaki ka. Pero nga,
Yes.
prolapse ng mitral valve is not rheumatic heart disease.
Okay,
Valvular heart
okay.
disease, at saka hindi kailangang operahan lagi yun.
Okay.
Meron siguro pag nag-investiga ng mga normal population, about 1/4 of our population will have some kind of prolapse of the mitral valve, which does not require any medications or any treatment at all. So normal siya.
Okay.
Ano siya, abnormal normal. Pero yung rheumatic heart disease, kaya sinasabi nating sakit ng mahirap, kasi right now, with the use of very cheap and very regularly available antibiotics, you can take care of yung sore throat na nagiging sanhi, not only of rheumatic heart disease that can lead to heart surgery in the future, but also to yung tinatawag na glomerulonephritis, ito yung sakit ng kidney that can lead to kidney transplant. So, sakit na napakadaling gamutin sana, pero hindi nagagamot basta-basta. Dati, ngayon nagagamot na. Ayaw natin nag-antibiotics ng tuloy-tuloy right from the start, pero pagdating sa punto na kailangan, dapat na ibibigay yung tama. Kasi if you can prevent the sore throats that are bacterial, yung mga staph, mape-prevent mo yung sakit that will cause end-stage kidney disease and heart valve disease.
So yung mga sakit ng mahirap is actually in reference to the fact na hindi nila mabili yung gamot. Yung mga
Dati. Ngayon,
nagkaka-UTI.
binibigay na yun eh. Yeah.
Oo, kasi noon pag nagka-UTI ka, sore throat o meron kang kung ba infection o whatever, ay hindi ba mabibili yan ng mga mahirap dahil napakamahal noon. Ngayon, binibigay na ng gobyerno. So maraming natutulungan. Now, Doc Jerry, we're down to our last few minutes. Could you just give suggestions Kasi marami pa rin tayong ako, honestly 'no, may mga kaibigan akong natigok kasi hinihingal na, ayaw pang magpa-test. Eh, ako nung huli akong hiningal na hindi, actually hindi ako hiningal, akala ko inatake ako sa puso. Nagpunta ako kay Doc Marlo Mendoza, sabi ko, "Doc Marlo, 'wag mo na akong stress test at, echo, 2D echo, mag-angiogram ka na dahil baka hindi ako mabuhay diyan sa stress test na 'yan." And true enough, I had the blockage. But many people parang hindi nila pinapansin itong mga hinihingal. Could you give us some tips before we go?
Ang pag sinabi mo hingal na related to COVID, importante talaga na 'pag dumating sa karamihan kasi ng may infection ngayon, maaring hindi man lang nila alam na may infection na sila. So they're asymptomatic. Lalo na ngayong mga bakunado na, vaccines work. Isang
Mhm.
importanteng message yan. And if you have not been vaccinated, kung hindi pa kayo bakunado, magpabakuna kayo. Makakatulong na hindi kayo lumala, kung magkaroon man kayo ng sakit, hindi lalala. Pero pag hindi kayo bakunado o kahit na bakunado kayo at saka meron kayo yung mga senyas ng COVID, nilalagnat, nagkaka-sore throat, at lalo na pag dumating na nahihirapang huminga, punta na kayo sa ospital. Kahit na puno yung ospital, aalagaan namin kayo.
Mhm. Okay, now yung heart attacks and I don't know because I have a hard time saying it, but I just lost a friend much younger than me. Uh, ang balita ko lang na heart attack, nagka-asthma, nagka-heart attack, hindi pa nila masabi kung nagka-COVID o hindi. So, asthma and heart attacks, could you just give us an idea?
In relation to each other ba?
Yeah, yeah.
Wala
Yung bang,
wala masyadong relasyon yun, eh. Pero 'pag
oh,
nagha-heart attack ka, mahihirapan kang huminga.
okay,
Marami
pero yung asthma ba, pag may asthma ka ba, dapat mag-ingat ka na kasi it could, in a bad situation, lead to a heart attack or malayo yun?
ang ayaw kasi ng heart attack may yung ma-stress ka. Eh, 'pag nag-a-asthma ka, nai-stress ka, 'di ba? The breathing is a stressful thing for an asthmatic patient, lalo na so kung meron ka pang nakapatong na o nakatagong sakit sa puso, mahihirapan yung puso mo. So anything
Okay.
that the heart attack is actually triggered by a lot of stress.
Okay, so chances are my friend may have had a heart condition that he didn't realize. And then
Posible.
when he had this asthma, so akala lang ng tao dahil yung asthma nag-trigger ng heart attack. So meron na pala. Okay, Doc Gerry, thank you very much for your time this morning. Any last word or message for our viewers?
Meron kasama sa tanong mo dito sa agenda mo na ano, eh, ano
Hmm.
ba ang ginagawa naming celebration? Pero tama dun sa unang question din kasi yan, eh. Ang tema namin ngayon, eh, "Isa puso ang makulay na Pasko." So, kami dito sa Heart Center, kahit anong kulay mo, gagamutin ka namin. Wala kaming kulay na kinikilingan, tutulungan namin kahit na anong kulay ang preference ninyo. Sana hindi kayo magkasakit para hindi niyo kami kailangan na tulungan kayo. But if you need help, we will take care of you.
Pareho pala tayo, Doc Gerry, na Heart Center at ng agenda. Puro po kami color blind, serving all. Thank you very much, Gerry Manzo, Dr. Gerry Manzo. God bless you and hope that you can recover from the sleepless night we caused you. Thank you very much, Doc.
Thank you, Cito.
Okay, that's Dr. Gerry Manzo, Deputy Executive Director for Medical Services of the Philippine Heart Center. Uulitin ko lang po on behalf of the Heart Center, wala po silang kinakampihan, sinusuportang political candidate. Hindi po totoo yung mga naglabasang Facebook post, page, website na nagagamit yung politika because the Heart Center serves all. And the same here in On Agenda. Wala po kaming politika. Kung magalit ako dun sa ilang politiko, kasama na po yun sa trabaho at kaalaman. I leave you with today's blessing, this week's blessing. Blessed is the man who trusts in the Lord and whose confidence is in the Lord. For he will be as a tree planted by the waters, who spreads out its roots by the river and will not fear when heat comes. Okay, that's from Jeremiah chapter 17, verses 7 and 8. Thank you for joining us here on Agenda. God bless all of you. Please keep it here on One News.